Hello, everybody. Jennifer Fleming here from the Alchemy Clinic. And today we are going to be talking about my most favorite topic, and that is the consultation process. This has really become a topic that I am extremely passionate about because I find that if we do not get the consultation process right, that our patients inevitably are the ones that sort of, in a way, suffer, right? So in aesthetics or in medicine, a consultation and having a systematized way to approach a patient is really imperative, because starting off getting to know our patients and ensuring that we're not missing pieces along the way, make sure that we are not going to miss anything with our patients, that we can ensure better outcomes, that we can reduce risks because we know our patients and we might approach things differently. And so here I'm going to break down. I have tried in a way to break this down to make you understand what goes through my brain when I am doing a consultation with a patient. So first and foremost, I start out with really number one is the introduction. So I want to get to know my patient. So when a patient comes in or is a new patient and is a new consultation, that is really a time that is imperative. And I think that as any clinician, we really need to give an allowed time in our practice to see our patients for a reasonable amount of time. It's not just a 15-minute appointment. It's maybe a half hour, maybe it's an hour. I know in our practice, we see patients for an hour, but this is a time where we are dating our patients. So I like to get to know my patients. I want to know a little bit. I want to know who you are. I want to know your history. Have you had any aesthetic procedures in the past? What was your experience with those procedures? Do you have any medical history that might compromise or limit what we can do here in the practice? And what are your expectations? What are you seeking? And it's important to understand what is sort of driving those things as well, because those are little pieces that are going to help us better care for our patients. So once we have, you've had that introduction, you've dated that patient, the patient is comfortable with you as a provider, and then you are comfortable moving forward with that patient because you feel like you are both aligned with regards to what you feel like you can offer that patient and in a safe manner. Then the next step is really the assessment piece, but I like to break that down into further segments because this is really the meat and potatoes, if you will, of really the most important piece, ensuring that your patient is going to get the best outcome. So I like to break this down into understanding where my patient is, whether that be, their decade of life, what their physical anatomy is like, and then breaking that down for the patient. So I really like to take pictures of my patients in all different angles, and then I utilize those photos during the consultation process. This is a much better way for the patient, rather than giving them a mirror in which they're going to look at their face, which they see themselves every single day in that two-dimensional view. Looking at a picture is a more objective way, and it feels less of an attack, I feel like, rather than sort of pointing to their face. I just don't like that. I never have. And I think that showing a patient a photo of themselves is a much more profound way that a patient then sees themselves in a different light, a different angle, and you are objectively going through the aging process with the patient. So I break down what I'm seeing in a systematized way. I start from top down, posterior, anterior, having the patient understand that oftentimes what they're seeing in that mid face is a symptom of what's happening globally. So your patient might be coming in and they're maybe concerned with their lips or maybe their cheeks, but we have to ensure that we're looking at different areas of the face, because if, for instance, we optimize their mid face, but they have severe temporal hollowing, well, we're likely going to exacerbate those temples if we're focusing on one area. So there's a way to sort of go through that process with your patient So when we then lead into the next step of the consultation, and that is the treatment plan or developing a plan, the patient now understands why you're telling them or suggesting certain treatments. And this is where you're really building that trust with your patient. If you just tell them, if we just tell our patients that they need this, and this, and it's going to cost this much, well, if I was the patient, I would sort of be taken back because I just came in for this one little thing here, and now you're telling me that I might need all of these other things. Well, again, it's giving our patients the tools, the knowledge, the understanding that this is what we're seeing. And I also like to sort of break this down into layers because our face is aging in layers, right? Our skin, our dermis, our fat pads, there's ligamentous changes, there are shifting of tissues. And so we have to focus on each of those areas and then suggest treatment plans based on that. So, and when our patients can understand this, because as a provider, when we can provide this information in a way that a patient understands, it is just more profound. And you, again, are building that trust. So once you create that treatment plan for the patient, be sure that you are suggesting these treatments in a systematized way. So meaning if you are suggesting energy-based devices, well, I would suggest doing those energy-based devices first before we maybe do dermal fillers. Or if we're going to use biostimulators like Sculptra, maybe we're going to suggest maybe starting with Sculptra first and then maybe doing some energy-based devices after to stimulate the process of what we've done. So it's really important that we give or set out a plan for our patient. And I like to do this in 6 to 12 months so that way you're really developing and we're going to get the best treatments for our patients. Next is really the execution, right? So if you're suggesting all of these things as a provider, well, then we really need to be able to ensure that we can provide all of those things in which we're telling the patient. And I like to say, if you as a provider know that maybe a patient needs a type of device that maybe your office doesn't have, or maybe, you're maybe a newer injector and you don't quite know how to optimize the lower face yet, then refer those patients accordingly. That's actually, you're doing right by your patient. And I think that we should always, as a provider and a clinician, is take a step back and always just making sure that you're leading with intent, that your patient's best interest is always first and foremost. For instance, if a patient needs surgery, I am going to refer them to surgery because that's what the patient needs. Now, could we do multiple things in practice? We probably could, but if we're looking for the best result and the best outcome, well, then referring at that segment might be the most appropriate thing to do to ensure that the patient is going to get the best outcome. And then even if they get surgery, they're likely still going to need other preventative maintenance down the road. And that's where maybe you fall then back into play. So utilize your resources. It's super important, and get to know people in your community, because I cannot tell you enough how important that is, so you don't feel like you're on an island alone. And then last but not least in the consultation process is ensuring that you and your practice and whoever else in your practice, however you set up your process, is following up with your patient. This is really the piece that I think a lot of people miss, and it not only allows our patients peace of mind because we are following up with them, we're ensuring that we have met their, hopefully met their expectations, that they're happy with their results, but it's also a very powerful tool for you as the clinician to see that patient back in practice, to get photos, because when we are, as we continue to grow in our own techniques and as a clinician, because we're always growing, we need to be able to assess the work in which we're doing, because you want to be able to give and see so that you can make tweaks accordingly for that patient. So seeing your patient back, making sure that they're well cared for, that really kind of just closes that circle. And again, I think that the consultation can be a process that sets you, when you become really good at a consultation, it is going to set you apart from your counterparts for sure. And just, again, always leading with the intent of putting our patients first and foremost, is we are going to get really great outcomes. So if you have any questions on consultations, or if you do things, or if you do things differently in your practice, I would love to hear it, because we can all grow and learn from what others are doing, certainly. So I hope that was helpful. Leave your comments below, and happy consultations.